Our program was actually started in 2006. It was started at the request of our former mayor of Boston, who was not happy with the fact that victims of gun violence were coming to our hospital and getting spectacular trauma care medically, but they were leaving with no resources on how to change or impact the trajectory of their life. This was really heightened by a surge in violence in the community around homicides, and homicide families were coming here. The victim was passed away. The families would be in our waiting room, and no one was there to support, comfort, give them resources, direct them. What we realized was the importance of the relationship building was great, but more so what happened was that victims, when they returned back to the community, needed support and guidance, attending court proceedings, getting help with job interviewing skills, going to school meetings for their kids, all of that, like all of the social determinants of health issues that arise with the folks that we work with. They needed more help. We also realized early on that, the mental health piece was huge, and that the traditional mental health offerings for clients like ours are not appealing. There's cultural and insurance-based issues, there's bias and stigma. So every time a gunshot victim comes in now, they get assigned 3 people, 2 people from our team and 1 person from our mental health team. And those 3 people work together with not only the victim, but with their family members.
We make sure that we cover all our bases of who's on scene, who the family was affected, to make sure that if us as a hospital can't connect with those families, we make sure we give them brochures and talk to them and get phone numbers, so other community providers that are in that community can help supply support for those families, to make sure that we don't leave no stone unturned, to make sure that they're getting their needs met, because everybody might not come to the hospital.
Trauma is vicarious. So we want to pass out the word that there's services to anybody in the community that might have been traumatized. For example, we've had older women who they needed some support because they constantly heard helicopters flying over their home. So, that kind of triggered something in them, and they needed services, mental health services, and they kind of needed just information on what's going on in the area, because it's kind of, traumatizing to hear a helicopter over your home, 4:00 in the afternoon. You don't know what's going on. You don't want to go outside and look. So we are, dispersed in the neighborhood so we can go door to door, car to car, business to business, and kind of interact with whoever might need our services.
We want to make sure that they know us when there's good times in their community as well. So we show up for community meetings. We listen to what's going on in these communities, because we know majority of our clients come from those communities. So we try to make sure we're resource rich when that happens, to make sure that we provide families and our patients with what they need versus the community, because we not only work with patients, we work with the community as well to make sure that needs are met.
One of our biggest things is, meeting the clients where they are in life and trying to kind of make a pivotal change in behavior, because these guys got access to firearms, heavy artillery, sometimes bigger than the police, and they can access that quicker than they can access the services. So we want to make services more accessible than guns. But again, to say that today's victim could be tomorrow's perpetrator. So we have a very important job in that little window. Introducing people to these different changes and different services is the key to changing the behavior.